Well, thank you so much, AG. For me, always a pleasure to be in conversation with you anytime. Look, we are all in agreement that these are definitely extraordinary times. We're in a disaster. We are faced with a pandemic, one like we've never seen before, well, at least in our lifetimes. And AG, we are all in agreement that disaster situations have a way of testing the resilience of both individuals and organizations. Now, during this time, AG, what would you say have been the key achievements of your SAI in relation to its mandate? And what plans do you have in place to continue servicing that SAI mandate, since there is no foresight? Well, for now, I mean, there is no foresight as to when this pandemic will be declared over.
Thank you for that. As you rightly said, this is a new phenomenon. Although we here in West Africa have had an epidemic like the Ebola, but this is unprecedented. We did not, it's not like, at least with the Ebola, you knew that when you went certain places, then you will be exposed. Unlike this one, I could be asymptomatic. You don't know. So it was it's a different kind of health crisis that we all are grappling with. But as you know, for us as an African country, when our infection rate was very low, and everybody was closing down, the president followed suit, and he closed down. So we were on a state of emergency with social distancing and masks. So when he announced that, he went, I think in February, he announced, like essential and non-essential worker. Even though we are autonomous, but we are not far from the government, and so we have to think about those rules. So then what I did then was the staff that are working on audits, we separated them, and then a lot of them, the other people went home. And then when he declared state of emergency, and here in Liberia we had state of emergency, and then we had a curfew. So the president instructed that everybody should be home at 3 and indoors. So with that, then I had to let the other staff go. But I still, in my thinking, if the other staff go and they had to get paid, someone had to be on ground. So I volunteer, and the DAGs and my finance people would stay so that staff would get paid timely. So we were here the whole while. I went and arranged for special tasks so we could drive and get around the city. But we were here, at least about like 50 staff were here. So and then we started to look at what should we do going forward. I also gave the staff that could afford it, we are challenged. If they want to work at home, from home, they could. And one of the guys, they were able to work at home. We work along with IDI, although they feature Sierra Leone, but we're in the background and working on our first paper. So we participated in that. And then we started to look on how should we handle this. So gradually, as he opened up, we brought in, because there are special audits that we have to do, like the consolidated fund. I brought those guys in, and we're working on our mandate going forward. What we try to do is, since we don't have the electronics to get electronic data from the different ministries, we would designate a staff to go and get, and to work with us to get those documents that we can work from our building. So that's how we are approaching this. So we've been working all along, trying to carry our mandate. But as you rightly said, it's a challenge. So we're all looking on it. How can we continue? Because we don't know where this. So we're still using that same trend or thought. We got staff in, and audits that were outstanding. We're bringing in staff, that can work on that piece of work and go on. And then gradually we might bring in, but we're limiting the staff still that are coming in because of the social distancing, and we don't want to be able to expose anyone to the COVID. But so it's been difficult for the past 6 months to say my success with my mandate, because we're all working on that. But I'm sure gradually we're maintaining, when we say we're sustaining what we're doing, at a minimum rate. Another thing that I did during the time that everybody was off, based on our experience with the Ebola, I suggested to the government to have an incident management center for the COVID-19. You have the health ministry. She has her regular work, and then you have the National Public Health Institute. So I thought that they should have a group of people that would be responsible to take care of the financial matters. And so we wrote about three letters to those that were concerned. We also had Zoom meetings, and I told them because when we have a pandemic or an emergency or a disaster, everybody get confused, and then we tend to do things that we're not supposed to do when it comes to the funding. So I reminded them since we were able to do Ebola fund real time, Ebola audit real time, we have another time. So I told them let's look at lesson learned from Ebola, and let's make sure that we have all those documents in place, because people want to be held accountable for the funding that they are giving us for COVID. So I sent those letters out to the finance minister, to the incident management team, and all those that were involved. So we did that while the staff were away, and so far that's it.
Excellent. Well, thank you, AG. I mean, quite a very clear process that you followed through, whereby you focused on strengthening the core of the SAI by making sure that those who are running the administration aspects within the SAI remain in, and they do work. And then I like that gradual approach whereby you are forecasting and using the insight of what is happening currently to then respond gradually towards getting back to doing audits and picking up on your mandate. But one question that comes to me, when you mentioned that you leveraged on past experiences from the Ebola crisis, now clearly you did do some audits with recommendations, which were quite seminal when I read some of the reports that you did. But would you believe that the recommendations that you gave during the Ebola crisis and how government reacted to
as I said, from the lesson learned, they did not appreciate the recommendation that we did. And so it was, in my part of the world is real politicking. So they play politics with that. So this is why early at the end of, I think either April, I sent these letters out and reminding them that we are not in another crisis. Please keep your expenses. And based on that now, I gave them the advice. So at the end of the fiscal year, June 30, I wrote a letter, and we'll soon do a COVID-19 audit. So we're in the process of planning our COVID-19 audit. We send the letters out, and we're waiting for them to send us the preliminary documents so we can do our pre-planning and whatnot.
But
would you to be exact, when you say I don't know whether the recommendation that we did from that they have implemented, because when I go to look at this new audit in real time, then I'll see whether they really thought about some of those recommendations.
But do you have any confidence that they actually did put them in place, or do you feel that your recommendations are falling onto deaf ears, AG?
Well, when you come to the, in both crises, I did recommend the incident management team center to manage, and they put those in place. Even from the Ebola time, they put that in place and they have it going. From what I'm feeling from the reading the newspaper and this in small discussion, it may not in place like it should be, but they have something in place. And they did a standard operating procedure manual, so we're waiting for that. But, you know, there were two different governments. It happened that the Ebola was under the president that was worldwide known, Madam Johnson, and now you have a different set of government. And from the onset, you know, there have been one crisis or the other. So when we go to audit, then we'll see exactly what they have on ground. I don't want to anticipate anything that they have done wrong at the moment.
Excellent. I don't know, Michelle. I mean, what are you picking up from this discussion so far? It's quite an interesting one, because the issue of following up on recommendations is very key to the heart of the audit office, because that's really what makes our audit reports worth anything at all.
Correct.
The recommendations being followed up.
You're right about that. Yeah. This is why we try to remind them that we had done recommendations, and please keep that in your mind as you work on this one. And we'll verify whether the recommendation has been implemented, or if the letters and recommendation means anything and they have done something. When we follow up, we'll be able to document it.
Yeah, because those are recommendations under the emergency situation. If I can just have take a slightly different angle. You have shared about your challenges, your successes, and you know, one of them being staffing, and I would imagine that the other one being ICT infrastructure. You know, when you have to balance between your normal mandate and the COVID audits. To what extent has the lack of ICT infrastructure or equipment, you know, sort of hampered what you would have wanted to achieve during this period, looking at both your mandate in terms of the Constitution and the COVID audits, and obviously expectations from the donors?
Yeah. As I said, the whole country, I'm in a different little boat because we have bigger challenges like the lack of electricity. I mean, we're being frank here. So before the internet can work, you must have electricity. And to be frank, most of us don't. We work from generator. So it's really challenging. But like one of my staff were able to really work from home. And during this period, we, in working with the donors, they had access to be independent verification agent. And we're able to do that because you were able to send me the reports. I read it and send it back. And then we're able to contact the people that did the expenditures, and we're able to do a report, and then we were on time. So if we had the infrastructure in place, the ICT equipment, I'm sure that we'll be able to do more as it relates to the mandate. But here in Liberia, I didn't expect those from the staff, you know, the kind of robustness that you will want if you have those immunities, you know, in other places. But the little they could do, because I could call on the staff and they would come in and do it. So I really appreciate that from them. But as we can all say this, we're all trying to see what is it that we can do that will do better to even carry our mandate. It's really difficult in this pandemic because you have to be really health is paramount in this case, and we don't know what the disease is. You don't want to send someone, child, a husband, or wife out there, and then the next time you know they have the how you call it, the hospital for recovery. So we are really playing it by ear. But so far, most of my staff have been understanding and will do what we can to further our mandate. I don't know if I answer your question in a roundabout way, but
in a roundabout
when it comes to ICT and we are challenged as a country.
Yeah. Thanks, EG.
No, very interesting. I like what your question has unearthed, Macy, from the AG. I mean, this is the first time that this concept has been brought up, but it's totally so relevant. I mean, how pervasive the question of service delivery is. It affects all of us. It even affects the way the audit office does its work. I like the way you say, AG, what good is Wi-Fi if I don't have electricity? Let's get that run. Let's get that running first time around, and then we can talk about all these other complicated things that we want to have. But now it leads me to my next question. I mean, we've been talking about, and you have been talking about, introducing the Citizens Eye app into Liberia, a very powerful tool that will make the SAI more accessible to the general public. Now, how useful do you think this app is going to be in the improvement of service delivery in Liberia, especially during disaster situations such as the one that we are currently having, and in view of the matter that you raised earlier, to say, look, a service delivery infrastructure that is not up to standard might just not be good enough for us to do our work in the way that we want to do it. The Citizens app.
Yeah, the Citizen app, from what I can see, it may not, unlike other countries that are working properly, it may not, but I can see the usefulness because unlike other things, everyone has a mobile phone, and then most of them have an Android. So it would be a good thing where we can collect those data and see that, hey, the health team did not come in this place, I mean, in contact tracing, somebody didn't show up or something like that. And I'm sure that, and especially when it comes to our infrastructure, like in road construction, which this government says is a priority, and then you go to places and you hear these complaints. So if we can catalog those, I'm sure that the Citizen Eye would be a good tool. We may not get the kind of data like advanced countries, but I'm sure that the little we get, if we package it right and can base our audit on the materials that we get from those things, I think it would be very impactful. And I hope that my goal is we can put that tool in practice and we can at least market it so that people can utilize it before I leave here. It would be a great achievement because then we can dedicate a staff that will collect those data, and in our planning, our audits, we can go and get them and be more and have some hands-on in planning the audit so they can improve the lives of citizens. We may not have all, but we do have. Everyone, I call you. Now I'm on the I'm doing a virtual medium with you, so I'm sure that we can work around it. It may not be 100%, but the 60% that we have, we can utilize it until we gradually improve it.
Excellent. No, thank you for that. I mean, a journey of 1,000 miles has to begin with a single step, eh? And that certainly is a very positive direction going forward. I mean, look, Ghana has used the Citizens Eye app, and they've been giving us some marvelous feedback on how it is helping them, especially like you're saying with the data, getting so much data which you can analyze and turn it into information which an auditor can actually use and pursue, of course, for the betterment of the citizens. And yeah, I think it's quite a perfect way forward. Hey, what do you think, Mason?
Yeah, absolutely. And AG, the question that I want to pose is just a generic one, just in terms of the response by the citizens. You mentioned quite big challenges relating to electricity, and some people having to, or most people having to use generators. And you know, you sound very, very positive about the citizen's eye, which excites us very much. However, it's all dependent on a citizenship that is quite responsive, and that will use the app for the right purposes. Do you have confidence and comfort that you will get that from the citizens of Liberia?
You know, like in any country, there's the fluff, and then if you train a person right, there will be things that it will have to look out. Like even when we do audit, we're more effective if someone gave an insider information, because then you can design your audit to go and look for that information. And that's how we find things. On our own, it's difficult for audit to review what is going on. So that citizen eye, if we get those data, and I'm sure that we'll be able to go in that direction. And right now you can see like they may be doing it crudely, but in the society now you will see people just block the road. We don't have electricity. People will say, oh, the road is the car, you know, it has a huge pothole, we can't block the road. So those are things I'm sure that's what I say we here, we need to make sure that we tell people that this is available and let them know. And that's what I plan to do. We have, you know, you have to have Zoom meetings or go into community meetings and tell people, then we'll be able, they will know the value. Because instead of you blocking the road, just let GSC know what's going on. And then they might do that. And one of our flagship project that we started, but then COVID just put a foot in it, was we started to go to the elementary schools and let them know the importance of GSC and its role in the society and the importance of integrity. And that was going very well. We have a few, I think we did about 10 schools, and everybody wanted us to go back. And then COVID came in, and so we will try to, plan some of these in some of our projects, so we can make sure that it's here. And I'm sure, and they're now civil society, because in this COVID, I know 2 civil society groups that are really tasking the government, putting them in how they are administering the COVID fund, so we can liaise with those. And make sure that the citizens get the kind of publicity that is needs to be effective. We know we have a lot of shortcomings there, but as Edmund said, we have to take the first step, and we have to try so people can know that things are available. We did a lot with stakeholder meetings for the past 2 years, and so I'm comfortable that there will be a difference that we can report.
Excellent. Elementary schools, you say. I mean, this thing is coming up. When we had a chat with the Auditor General of Ethiopia, he also mentioned the issue of educating at the very basic level, yes. The people, the citizens, on what this SAI can do and what it should be doing. But now comes in the question of corruption, AG. I mean, across Africa, we've been having several cases of high-ranking government officials being implicated in corruption charges, especially around the emergency COVID-19 related procurement. But tell us, what has been the experience from Liberia during Ebola and during COVID-19 pandemic? I want to link corruption with the youth, in the sense that it eats away at their future.
Correct. Yeah. During the Ebola, I think when we did that real-time audit, I mean, people that are involved in that audit that we know, because as we say in an emergency, people are not, especially, it was an epidemic and people were confused. So, you know, the smart one and they would try to do all they can. So some of the people that we audited, I mean, they went on the radio station and sent me a 32-page letter that I should resign. I didn't know what I was doing and all that crap. And then I always like to put kerosene on the fire. I said, I stand by my report. Yes. Then, they were real mad. But you know that's because they were not, you see, they would not give you the receipt. So if you bought something, where's, so those little petty things like, and it goes bigger. And here in Liberia, and we know how to do it a little bit, you know, through procurement, which is hard to track, because most of them have these pseudo companies, and they will buy things through them. So we have that problem with Ebola. This is why I warned them. And in my letter, I said, please have your documentation, and we'll look at it. And we hear these, but these are hearsay that they're doing a lot with the COVID funding. But we have not tested it. So I cannot come and say, well, it's evasive. But the reason why we go to these, because corruption seems to be pervasive in Liberia. I don't know, but when you go to other African countries. And if we don't start with the young kids, you know, so we can instill these things in them, then it becomes, who is the government? It's me, you, who are in the public. You might get nominated, elected, or nominated to go hold a post. So if you have your correct practice and you think I would leave it behind, no, I would not have a sophisticated way of doing it. So that's why if you bring this to the forefront and you discuss it, I think from the young kids, they can ask, Dad, why did you think that, or something? So this is what the thought process. But we hear it, but I cannot verify that someone has misappropriated government fund. But all the time they do. And how we do it in Liberia is we throw the document away. So most of our reports are inconclusive because we don't have a lot of the documents, so we can't say give an opinion on it.
Exceptional. Prevention is better than cure, they say. Yeah. And certainly having an audit office which is as vibrant and as visible as yours, Auditor General, it's inevitable that so many bad things that could happen are probably being prevented by the mere fact that they know that the audit office is there. But AG, as my parting shot, before I give over to Macy so that she can wrap this up for us, I mean, your office is truly the proverbial voice of accountability and good governance in Liberia. Yeah. Now, I know there's a high probability that Liberians are going to get a chance to listen to this interview, not only people from your side, but also some citizens, as we're going to broadcast it and give it out to the world to listen to. What mitigating message do you have for the people of Liberia when it comes to corruption as the voice of accountability and good governance? Over to you.
Thank you for that. What do I tell my people? We as Liberians are the government, believe it or not, and whatsoever we do affect all of us. So we should not condone corruption, not because you have a friend that can give you part of the loot, then you turn your eye. But this has robbed us of our country. And if you take the nations of the world, Liberia is at the bottom. Our people are poor. So we need to all work together. And if we sit back and do nothing, that means we're part of the problem. So I ask, you will not be reporting someone when you say you see that the crushed rock that is there to build the road, someone has taken away, but there they are preventing you from having a good road. So we need to speak out publicly when we see these things done, because it's our future. That's what I would tell my people, really.
Solid. Over to you, Macy. Very solid.
Excellent, AG, and thank you so much. Thanks for the time and thanks for the insightful sharing that we've heard from you. AG, from my side, I just want to hear from you. We've made promises. I've indicated that we've made promises that we will be writing a pocket guide for real-time audits. You've done this before, and you've cited the benefits that came out of it for you, for government, and you know, we don't work alone as AGs. We have colleagues across the continent, and we work very closely within the AFROSAI-E region. What is the one key thing that came out of the real-time audit that you did on Ebola that you would like to make your colleagues aware of when going into any future disaster, including this COVID-19, if I may ask?
You know that if you do when you do a real-time audit, you, as the audit office, you kind of mitigate. It's something like a preventing. You prevent what the bigger things are, because people know that the auditors will be there, so they may try to slow down their activities, their corrupt activities. So by doing that audit, because when the audit result came out, then when you go to when it was a saying, when you go, the auditors are coming, so you kind of in your mind that someone will be able to look at the expenses, so you kind of will be more careful, and that's what that real-time audit does. But a real-time audit is necessary because most of the time it's in procurement. So if you can stop it before it gets bigger, then I think it's a better benefit to the people, because we are external auditors coming after the fact, and it has been done. They may be able to recoup, but for the meantime, there has been damages that you cannot capture. So that's what real-time audit does. And that's what it did in the Ebola, because people are more careful and in going forward.
It is very interesting that you say this, and this is not part of the questions of the interview. I'm just making a conversation now. It's very interesting that you say this, because the big part of it comes in the internal controls that are implemented in our governments. Correct. And you are saying if people in government know that the Auditor General is coming, they slow down so that they adhere to the control.
Yeah. Yes, that's it. They try to. They may not do it, or can we say maybe they might find a room around the controls that they think. No, but normally they will try to adhere to the controls. Because they know, even though you have the internal auditor there, they're doing their work, but when they know that, because our reports are public, so then they will adhere to the controls.
But they need to know that even if you are not there during any point in time, you are coming back, so you will pick up whatever it is that they are doing. So they can never hide it. But what I'm getting is that we have a responsibility as the SAIs to make sure that we hold government accountable through our audit to institutionalize internal controls and not only implement them when they think it is time or they don't want to be caught, but to institutionalize them and make sure that they work all the time.
Yeah, that's true. But look, let's be candid here. Our office is effective as the executive wants it to be, no matter how good the SAI is, because the executive has to implement these recommendations. The executive has to, and together with the legislator, they have to hold people accountable when you do these reports. But if they don't, people might dismiss it. Because over the years since I've been here, we've done some good reports, but they are not, I get frustrated. They're not going anywhere because people will say, oh, yes, they've done the reporting, and so what? So you have to have punitive measures with these. And I think this is one where you look in most of our African countries, we don't do. You know, we don't do. And so people, the audit just have been an afterthought, you know. Yeah, it will happen, but what? You know, so we have to really work and advocate that countries do something, because to me, if you set an example, is a deterrent. And here I can talk freely about my country. It's a nation that there's no punity. You know, you can see the person that hand the cookie jar, well, and they'll go around and nothing is done. So as a result, corruption is pervasive, really.
Just to say something, Maisie, I know I had logged off and I said, look, I'm done for the day.
No.
The way she has spoken so passionately about what's going on, and we know very well that it's something that is across Africa. I think our October meeting with the AGs is going to be explosive when we have interactions like this. Maybe what we need to do is probably, I don't know, Mace, I'm just putting it to you. Maybe what we need to do is we really need to take down some of the minutes of that meeting and then actually write a report to it and give it to our people to read so that they understand the frustrations of the AGs as a collective. What do you think?
Absolutely, Ed. That's a brilliant idea.
It's frustrating, really. It is.
Yeah.
You know, you do the reports, and then to me, it's a waste of resources as well, because I get paid, my staff get paid, we use funds, and then you say, okay, the work you do is nothing. That's how I feel. I mean, most time.
Yeah. No, absolutely.
And you put it,
Yeah, that's a brilliant idea. I think AG is talking passionately about this topic, as they normally do in the governing board, about the independence of SAIs. So certainly it's something that we need to take very seriously and make sure that we share across. AG, any last words from you? I don't want to be the last one to speak. I want you to be the last one to speak. From my side, thank you very much for the time. We appreciate the insights and the words of encouragement and the honesty with which you spoke. Yeah.
I think again, I thank you for giving me the opportunity, and I always appreciate the Secretariat, because, and AFROSAI, even the other AGs, because in our position as AGs, we need that support. You need that meeting of the minds, and what AFROSAI-E has done, it brings a group of people together that really wants to do something and make a difference. And then we have a secretariat that gives us the support for us to be able to, in unity, do what we do best. And you're there for us to improve our internal organization so we can do a better job. So I thank you again for giving me this opportunity, and I really have had a blast working with this group as AG of Liberia. Thank you so much.
Thank you, AG. Blessings to you and the rest of the staff, and continue with the good work.
Cheers. Thank you so much.
Thank you.